specific document which we are really talking for Minister of Health towards a climate with these vote of thanks. I just want to say that
Bulbina, WHO representative Dr. Nasser, welcome again to the Ministry of Health. The director of Quaker in Fiji, the new one, Kamsamida, so we welcome you again, Bulbinaka, and welcome. Representatives from JICA, the Permanent Secretary for Health, Chief Medical Advisor, and the senior executives of the Ministry of Health, World Bank and Asian Development Bank, Pacific Community, the Facility Health Program, Fijian National University, the acting head of school public health, representatives from the different government ministries, ladies and gentlemen. I am pleased to launch the guidelines for climate resilient and environmentally sustainable healthcare facilities in Fiji, and in doing so we are the first in the region. Just 3 months after WHO launched the global guidance for climate resilient and environmentally sustainable healthcare facilities. I acknowledge all the hard work that's happened over the last years up until today, the amount of work that's been happening both from internally from within the ministry and also the work that's been done in the support through development partners and the guidance provided by WHO in this very important aspect of making sure that our facilities are climate resilient. This is a landmark achievement, and it sets the tone for regional growth, dialogue and collaboration among small island development states as we continue to fight the increasing effects of climate change within our region. I keep on saying this, we cannot change our coordinates. We are locked in at the 180-degree meridian, and it is important that we acknowledge that climate change and the effect of climate change are the things that we have to deal with constantly and make sure that we mitigate in certain ways so that we can be able to withstand the effects of climate change. It is dear to us, and the Honorable Prime Minister, as we all know, is a champion of climate change, both at the Pacific level and also at the global level. And in that state, all of us in government are to ensure that we actually put climate change and the work around climate change as an important part of what we do. I'm delighted to know that this document, as I've alluded to earlier, is a collaboration amongst many stakeholders, including the high-level consultation that I was part of in October last year. And I really learned a lot from those few hours that I sat in the Pearl and just understanding about the many work that have to be done around making sure that we're able to push forward with this. There are work that has to be done in retrofitting some of our facilities, but also there's opportunities for making sure that when we do build now, we build back better, and ensuring that we are climate resilient, environmentally sustainable healthcare facilities that we are working on. Again, echo my great appreciation to all our stakeholders and development partners. Your presence and show of support indicates that we are in this journey together. The climate change impacts on health can never be overemphasized, and the recent cyclones have exposed our health systems in the need to build back better with approved global best practices and standards. And in doing so, I just want to also remind us that not only the facilities are affected, but also the pathology of what we face. And climate-sensitive diseases continues to be a challenge not only in Fiji, but in many parts of the world. Small island development states are vulnerable, and their facilities are vulnerable. They experience inundation due to rising sea level. Drinking water is a challenge because they may no longer be potable because of saltwater intrusion. Likewise for inland facilities, and we have a lot of inland facilities, unpredictable rainfall pattern causes flash flooding and related infrastructure damage, and on the other hand, remote facilities in the Western Division are frequently faced with prolonged dry weather that directly impacts health services. Just yesterday we saw what was happening with the flooding in the Western Division. It wasn't a prolonged rain, it was only for a short while, but the fact that the water table may have been relatively high, we've seen flooding that continues to happen. Significant structural damage have been caused to our facilities in the recent tropical cyclones, and we've had to deploy our FEMAT to help manage post-cyclone surge. Therefore, the guidelines that we are launching today is very relevant and timely to build climate resilience into our health system, and ultimately that effect will then go back into the population. I also want to add that in the midst of the cyclone in Mua, when the tropical cyclone Yasa passed through, which was a Cat 5, our recently renovated $3 million renovation to Nambualu Hospital was of great use. It was safe for our patients, it was safe for our staff. It was also safe for those who were able to come up and utilize that hospital as a place of refuge. WHO defines climate resilient, environmentally sustainable health facilities as those capable to anticipate, respond to, cope with, and recover from, and adapt to climate-related shocks and stresses while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it, so as to bring ongoing and sustained healthcare to the target population and protect the health and well-being of future generations. Ladies and gentlemen, I'm confident that with your support, we will achieve these targets in the near future. Furthermore, the guidelines is an initiative of the Ministry to provide information on building climate change resilient facilities and support Fiji's efforts in reducing greenhouse gas emissions and strengthen climate resilience and environmental sustainability. The process of developing this document involved extensive consultation with WHO technical support. Sir, I'd like to thank you again for you personally in your work that you've been doing with our, especially our environmental health officers, in being at the front line together with our asset management unit in the work that we're doing around this. And thank you again. The guidelines have 4 fundamental prerequisites. They are 8.1, health workforce. We need adequate numbers of skilled human resources with decent working conditions, empowered and informed to respond to the environmental challenges. 8.2, water, sanitation and healthcare, waste, wash and waste management. Healthcare facilities need sustainable water, sanitation and healthcare waste services. 8.3 is energy. Ensuring sustainable energy services is important. And number 8.4, infrastructure and technology. Appropriate infrastructure and technology, including all the operations that allow for the efficient functioning of the healthcare facility. In addition, the guidelines have all the necessary assessment templates, reporting protocols, and the SOP to guide the full processes of meeting climate resilience and environmental sustainability. I'm also pleased to say that the Ministry is anticipating a strengthened working relationship with COICA, thank you, sir, in building climate resilience in our health system, a project we hope will commence soon. I look forward to this partnership and anticipate working with the new country director. The continued support from WHO to produce this document is acknowledged, and I personally thank our development partners and stakeholders for these great achievements, and I look forward to your support in the implementation of the guidelines.
Thank you.
Lavalibu, thank you.
Honorable Minister, thank you, sir, for being here. Permanent Secretary. Distinguished guests, which I not mentioned, but I'm very happy with you all here. And ladies and gentlemen, good morning and Bula Binaka. First, to inform you that the WHO Director, Dr. Corinne Capuano, has moved to Manila as the number 2 in the regional office in Manila. Why I mention her name, she is also the very, very strong support for the climate change and health in Fiji in particular, and also in the Pacific. So through her guidance as a director, then we work very closely with the Ministry of Health how to push on or to build climate resilient healthcare facilities or climate resilient health sector in Fiji. It is my great honor to address on behalf of WHO at the launch of these guidelines for climate resilient and environmentally sustainable healthcare facilities in Fiji. Congratulations to the Ministry of Health and Medical Services of Fiji for your leadership and dedication to reach this important milestone, this very, very important milestone of this work. This guideline that the Minister have launched just now contextualize the climate resilient and environmentally sustainable healthcare facilities since it launched at global level in October last year. The guideline itself has gone through with tremendous consultation, and we have been with Fiji every step all the way. So we like to continue our cooperation if there is any way that we can provide continuous guidance and support to work very closely, we'll be happy to do so. And slightly outside the text here, this guideline is just a starting point, because from here then we'll be able to see how vulnerable is healthcare facilities in Fiji to climate change or climate change shock. to sea level rise, to severe temperature, to saltwater intrusions, and a few others as well. So from this, we'll be able to identify how many of healthcare facilities at the different level are vulnerable to climate change impacts. From there, we'll be able to identify what are the gaps that we need to move on to build what we call as healthcare facilities that are more resilient to climate change impacts. The next one is more capital intensive, because but the one that when we want to build, say we want to retrofit hospital or healthcare facilities, or we want to relocate, for example, and that's where the investment is really needed. Not only in water, but also in energy, but also infrastructure itself. So when Dr. Corin was asking, when we prepared this, Dr. Corin was asking me is that how far this guideline will go, and I said, without this guideline, it's also difficult to move on. But this is not the end. This is really at the beginning, as PS mentioned, that we need to see something on the ground with regard to the climate change impacts. We have been working very, very closely on this. And we are very fortunate that we have a new project supported by COICA, and not only COICA, but also other opportunities as well. So I'm saying like the World Bank, the ADB, and other who are looking for investment in the infrastructure, especially in the healthcare facilities, to also consider this, because this is beyond probably one agency to build or to address this. This is intersectoral, and this need a very, very strong political and also community engagement and support to build a new generation healthcare facilities in probably 10 or 15 years in time, in that sense. So for that matter, I think we also want to, we have to work very closely to make sure that we can optimize or mobilize the Green Climate Fund, for example, that can support Fiji. This is where GCF is there is an opportunity there. But definitely the COICA funding and other funding itself is a starting point for us to move on to the next generation, to the next phase itself. We are also very fortunate that WHO has established a technical advisory group on climate change and environment, CCETEC. The CCETEC constitutes 16 prominent personalities at the global level. Some of them poets like someone from Marshall Island, but there is one representative from Fiji who sits in the CCETEC, who is our ambassador, your ambassador to Geneva, and then she's also the new president for the human right, the UN Human Rights Commission. So she sits in the CCETEC, and this CCETEC will be guiding WHO on how to address, how to move on with the climate change and health, in particular in the Pacific, and in particular not at the conceptual level, but how can we translate this, whether mitigation or adaptation at the ground level, and eventually goes down to the community level. So this is I said this guideline is very crucial for it's a very important milestone, and with that, sir, we will move on from there. Thank you very much.
Thank you very much, sir, for the launch. We will afterwards would like to ask our Chief Health Inspector to move. Thank you.